Hello. I just wanted to talk about another publication of ours, accepted yesterday, and why people in psychiatry are not letting innovations to become reality of clinical practice. So the thing is that we don't speak the same language. People who are working in psychiatry are relying on well-described and supported practice supported by their colleagues, relying mainly on DSM-5, scoring the answers of the patient who come to a standardized interview, and almost none of those meetings are including measuring of any kind of objective biomarkers, like, for example, heart rate variability or ECG or EEG or some sort of biochemical biomarkers, or maybe the resistance of the skin and other ways of detecting and validating the physiological response from the patient. I did a research on extracting biomarkers from electrophysiological signals like electroencephalogram and electrocardiogram, and we already published quite a number of publications, not only myself, my other colleagues as well, that it is possible to improve diagnostic and treatment and understanding how the patient is reacting to those treatments via those electrophysiological biomarkers. After more than a decade of research and so many publications in that regard, there is zero advancement in practice. Why it is so? I'm trying to work and advocate for complexity measures in medicine, not only in psychiatry, but again, I have an impression that there is a gap between understanding of people who have medical background who are active as psychologists and psychiatrists, because in their curricula there is no mathematics and physics, which are inevitable as base of understanding of those methodologies that we are applying, because those methodologies are very useful in any advanced statistic approach, let's say in statistical physics, in physiological measurements, but those are mainly used by people who have engineering background or are physicists acting as experts in medicine, like in neuroimaging, for example. The thing is that those complexity measures I'm talking about are actually so easy to understand if you simply get rid of that first obstacle, which is fear of unknown. This is so human, I understand that. Many people are actually afraid of something which is not known. But in order to learn anything, you have to simply ignore it or make it somehow non-relevant for the conversation. Then your eyes and ears are open to hear something unorthodox, something new, which in this case can improve significantly your approach to your goal number one, IDEST for psychiatrists to help their patients. And not only that, complexity measures are very well defined in giving biomedical biomarkers for psychiatry and other fields of medicine, but also in last 10 years there are numerous studies of joint approach between complexity measures and machine learning in medicine. Recently there were a number of publications about why, after all those publications, psychiatrists are still reluctant to believe that this is effective in their clinical practice. I can hear after other publications that I commented on this channel, for example, the one which is demonstrating that the effect size of use of any antidepressant medication and also use of antidepressant medication and psychotherapy in a number of mental health issues has very modest side effect. I can see the shift. Some people already start talking that they are going to ditch DSM-5 at all. I don't know what they're going to use after that. Then some of them are advocating, should we completely stop using antidepressants, because now we have much more questions than 30 years ago, because we know much more from their actual use. But the thing is, nothing in this life is actually black and white. This problem is no different. So human beings are very complicated and every patient has a different set of influences from surrounding in their physiological makeup, genetic makeup. Every single person is such a unique combination of those factors that you cannot generalize easily anything you do. I hear many questions from the side of medical professionals, and especially in psychiatry. Why should they trust machine learning and AI applications in medicine when they're actually showing to be not so effective? The problem is elsewhere. People who are actually in media, like in many other things, they're inflating some things that they read. For example, very often I had the chance to see that someone who is a journalist and who is covering some scientific research actually put something out of the context and interpret it in a completely inaccurate way. This also happens to machine learning and AI. People are calling AI everything. I just read yesterday a very interesting and brilliant article about one of the founding fathers of machine learning saying, don't call everything AI, because this is simply not true. I think that if people would understand these concepts much better, would not support the hype for AI unconditionally anymore. But this is not the case. People usually sway to some other people's opinion, and as it is known in cognitive science, this is a cascade of approval because many people agree with something without rechecking that. So this is also the case of AI application in medicine, and in particular in psychiatry. There are some publications that tried to analyze the situation, and they're actually saying that medicine is for the reason so reluctant to accept innovations because we are not talking about whether something is spam or not, but we are talking about appropriate therapy which can save lives, or the treatment which is much more complicated and much more important thing than the decision of whether something is spam or whether this is a cat image or something else. So that boils down to the discrepancy between algorithms developed in commercial applications, which are using web-based data, much more easily collected, than really curated medical data, which are coming from research hospitals. This fact that many algorithms are developed for much narrower use or used for something much more complicated is not justified. To cut things short, this all boils down to the matter of trust. The matter of trust of the patients and their doctors, which is regulated, and the third party who is actually analyzing those information in order to improve efficacy of a medical professional in clinical decisions making, to be more on the side of improved assessing and addressing actual problems of the patient. So I think that both sides had to have some compromises. For example, there is a big question about the GDPR compliance of the data, but once you start applying any kind of model to resolve certain medical problem, to try to forecast something, once you anonymize the data and you removed all the personal information for the patient, you're actually reducing the accuracy of the prediction. So, what do you want? To have accurate prediction or to keep GDPR at any cost? I would ask here, what is the purpose of all this? If you really want to improve the saving of lives, early diagnostic and treatment, personalized medicine, you really have to open the data. One of the possible solutions for this is opening the data. There are some initiatives which are advocating for all the patients to donate their data, positive or negative, in search for certain disorder, in order to improve possible detection for the future. And people would do that willingly. And my question here is, what do you think about this? I would like to hear from you. What do you think about AI applications in psychiatry?